Break down the latest numbers now. Governor Charlie Baker noted a slight rise in both the number of cases and in patients hospitalized with COVID-19. Western Mass News reporter Audrey Russo joins us live in Springfield with more on that. Audrey?
For the last few weeks, Governor Charlie Baker has been stressing that the one metric he's looking at to determine reopening the state is the hospitalization rate, which from Tuesday of this week to Wednesday of this week did increase slightly. But overall, it's been holding at a steady 5% hospitalization rate. We spoke with a microbiologist about why it's so important for officials to be looking at this one number.
If the disease was still spreading at the same rate, you would still have the same number of people in the hospital.
Despite a slight bump in COVID-19 ICU patients from Tuesday to Wednesday, the overall hospitalization rate in Massachusetts has held at 5%. Western Mass News looking at the hospitalization rate data since the end of April, it's gone from 7% to 5%. UMass microbiologist Erica Hamilton says a decrease in hospitalizations is important for officials to note.
It begins to tell you not only is there less transmission of the infection, but it also tells you that the hospitals have things under control and there is more space for sick people if someone else does become ill, whether it is COVID-19 or not.
But the number of positive tests by date, another metric outlined in the federal reopening guidelines, has been an up and down line, something Governor Charlie Baker noted in Thursday's briefing.
The positive test rate for this particular batch of tests was 28%. Now, over the past several days, this number has been trending down closer to 10 to 20%. So we're obviously going to take a close look at that data. But even with yesterday's data, less than 16% of tests over the past week have been positive, which is lower than at any point in April.
Hamilton says that number is likely less steady because the testing process hasn't settled into a pattern yet.
Who is being tested and which test is being used. So that is going to happen a little bit until our testing rates become more consistent and more people are tested.
She says the capacity of the healthcare system, measured by the hospitalization rate, is critical in making sure resources aren't overstretched.
Even if the number of positive cases goes up and down, that it may indicate that on the 18th, we do begin to put our plan in place for opening the state back up again.
Now, aside from reopening golf courses, and we'll have more on that coming up later in the broadcast, Governor Baker hasn't said what other kinds of businesses he anticipates opening first when the state does eventually reopen. He says that he'll look at how other northeastern states formulate their reopening plans. And of course, the State Advisory Board on reopening is set to have their plan ready by May 18th. Live in Springfield, Audrey Russo for Western Mass News.